Great. Okay, right, let's get going. So my name is Rose Hitchman, and I'm the Deputy Head of Department for Healthcare and Early Years at Trowbridge. So I look after all of the Trowbridge provision. So we run health and social care courses, early years courses. We also run some counselling courses for adults and some HE courses as well. So we're really busy at our Trowbridge campus. But I'm going to tell you specifically a little bit about health and social care today. I'm also going to be doing a talk at 11 o'clock on early years, in case you're a little bit undecided about which one you want to do. So please feel free to stay on and join the early years link, and then you'll hear a bit more from me, really. So let's get cracking. So this is what we are going to cover today. We're going to have a little look at our wider department. We're going to have a bit of a chat about the health and social care sector. We're going to have a look at the courses that are available here at Wiltshire College and University Centre. We're going to look very importantly at the entry requirements, what you need to get onto our courses. I'm going to give you a little bit of a chat through the courses that we run here, talk about progression within Wiltshire College and also progression outside of Wiltshire College. So some of you may already have decided that I'd like to become a nurse. Unfortunately, we don't run nursing courses here at degree level, but we do run some health and social care courses at higher education level. So I'm going to have a bit of a chat with you about those. Also progression outside of Wiltshire College. So again, those kind of nursing degrees and things. Then have a bit of a chat about student life at Wiltshire College, and then also about the safeguarding and tutorial team, which is a really, really important part of your course. Okay, so the Health and Life Sciences Department. So Health and Social Care sits within Health and Life Sciences. So obviously that includes health and social care and early years, but also within our nice, big, huge department, we have sport, public services and criminology, access to HE, sciences, including forensic science, counselling and apprenticeships within healthcare and early years and science. So we're really, really nice wide department. We do lots of work together. We quite often have teachers that teach in different parts of our department. So you'll get the specialists for the subject that you're learning about. We have one head of department who's my boss, and he looks after all of those different courses and all the different campuses. So we have campuses also at Lackham and Chippenham and Salisbury. And we also have a campus over at Castle Combe, which is mainly kind of for motorsport and engineering. But as I said, my name is Rose Hitchman, and I look after healthcare and early years at Trowbridge. Okay, so the health and social care sector, obviously it's been in the news a lot at the moment because kind of there's lots of heroes doing some amazing work in the midst of this pandemic. It's a really, really wide and varied sector, and there's lots of different careers within it. So it's quite a good area to kind of get into. So for example, if you're thinking about completing your level 3 in health and social care, that can lead you on to a multitude of different careers. Not just becoming a doctor or becoming a nurse. It's not just working with older people. There's so many different avenues that you could go down. Okay, so healthcare is the treatment, prevention and management of health and medical conditions. So that's what when you think about the NHS, think about kind of any occupational therapy, things like that. So these kind of, we'll learn quite a lot about different diseases, illnesses, injuries, and actually how to prevent these or manage these conditions and how to keep healthy, essentially. Social care is more to do with non-clinical, so it could be to do with areas of social development, supporting people to socialise, looking after people generally. Care and support services are offered to individuals, groups, adults, children, elderly and families. So as I said, it's 0 to 100 plus, 100 plus. It's a really important overlap between the two, which is why we keep these courses together when we teach health and social care, because lots of the skills that you will use within social care, for example, are also applicable in health. Health is not just about learning about the heart, it's also learning about how to look after your patients and how to communicate well with them. It's not, they kind of, this is why we teach it all together. Okay, different organisations and professionals will work very closely with each other, and these are kind of some of the things that you will learn about on our courses. Okay, so as we said, hospitals. So you might end up, if you do kind of health and social care and go down that avenue, you may end up working in a hospital or a health centre, possibly in a nursing home, or even in foster care. You can get into social work from doing a health and social care degree or course. And I put there at the bottom, health and social care offer a range of occupations, and some examples might include doctors, nurses, social workers, counsellors, paramedics. It's really, really, really nice broad sector to get into. Okay, so these are the courses that we run specifically at Trowbridge. So we run a level 1 course, which is a level 1 diploma in vocational studies, which is a really, really good introduction. I'll tell you a little bit more about it in a minute. specialising in health and social care and childcare, so you have a bit of a childcare in there as well, and also employability skills. So if you're looking at getting back into education, that's a pretty good course to go on. The level 2 is an extended certificate in health and social care. Level 3, it's essentially a 2-year course. So you'll see here on the list that there's a year 1 and a year 2. We also, once you've finished your year 1 and year 2, or if you've done a BTEC or some A-levels elsewhere, we also run higher education at Trowbridge. So this is level 4 and level 5. So this is our HNC, which is a higher national certificate and higher national diploma in social and community work, which is based at Trowbridge. And we also run a full social work degree, which will qualify you to become a social worker, which is also run at our Trowbridge campus. It's very exciting. Okay, entry requirements, important stuff. So for our level 1 provision, we expect that the students that come on to have, sometimes it's 3, sometimes it's 4. It depends on the kind of GCSEs that you've got. For example, English and maths are really, really important to have at a grade 2. You will complete English and maths alongside your qualification, especially at level 1 and level 2, if you haven't reached that grade 4 at English and maths. If you've reached grade 4 in English and maths and then you've got some much lower grades in other subjects, what we do is we'd have a bit of a chat with you and find the best fit for you. Okay. The level 2 health and social care is 4 GCSEs at grade 3, or a D for people like me who still sometimes work a little bit in the letters, including in English and maths. But we do make allowances for students who are progressing from our level 1 courses. So students that have completed level 1 with us, we would expect that they would progress onto a level 2 provision. Okay. The level 3 health and social care, which is where quite a lot of students like to enter. It's 4 GCSEs at grade 4 or a C, including English. Maths can be retaken along the qualification. This will be built into your timetable, but we would like students ideally to have both. We understand that sometimes students may not feel as strongly about maths than they do about English. English is really, really important to have as you come onto this course, because there are exams as part of the level 3, which I'll tell you about in a moment. Whereas maths, it's manageable to kind of take that alongside. Okay. Students wishing to progress from level 2 must be working at a merit level. So if you've come and joined us and you have completed your level 2, yes, great, I want to go on to level 3 now. You need to make sure that you're working at about a merit and have passed their English. That's really important. All students on level 2 and level 3 will need to complete a DBS clearance. I'm hoping that you might have a bit of an idea of what that is, but that's essentially a criminal records check. So it's to check that you haven't got any criminal records. And if you do, if you have anything on your criminal record, we'd need to have that discussion with you before you started the course, because we have to work very closely with our placements, which are a very important part of our courses. And as you may know, quite a lot of educational health settings would not take students or kind of employees with certain things on their criminal record. There's certain things that we can get around, but we would expect students to have a clear and a clean DBS. We'd also, which is actually not on here, I think I've mentioned it a bit later on, we also ask that students purchase a placement t-shirt. So that's a kind of, for level 2 and level 3, we'd expect students who have a placement t-shirt as part of their kind of when they join. Okay, so I'm going to tell you a little bit more about the individual courses now. Okay, this is our level 1. I'm hoping everybody can see the PowerPoint. No one has mentioned that they can't yet, so I'm hoping that everything's okay and everyone can hear me. So our level 1 Introductory Diploma in Vocational Studies is our level 1 provision that we run for those who are have just finished school and didn't quite get the grades that they were hoping for, or for those people that are maybe thinking about retraining. So maybe kind of you're 18, 19 years old, you've been working for a while, you're thinking, I'm not sure what I want to do. I'd like to get into health and social care. We would have that discussion with you at interview and find the best kind of match for you. Okay, so a level 1 provision is very kind of, it's very practical. Lots of tasks to be getting on with. It can lead to a range of vocational qualifications. So what happens with some students is they decide that they want to do health and social care, and they come and do the level 1 and learn a lot about health and social care and actually think, actually, childcare is more for me, which is absolutely fine. And this can lead very nicely into going into the level 2 childcare program. Okay. Our level 1, one of our aims is to teach transferable and sector specific skills. So lots of work on communication, working within a team, working independently, those kind of skills that are will be able to really help you in your future career. Okay, so you will have units from health and social care, so specific health and social care units. You'll have some childcare units. You'll have some units that are all to do with the community and helping around the community, which is really important in health and social care, and also some kind of units around employability skills, so being organised, making sure that you're able to turn up to work on time, interview skills, things like that. Okay, it's a little bit more. So this qualification is graded as a pass, merit or distinction. Some example units are listed here, and there's things like advising others about healthy lifestyles, which is really, really important. Communication skills, as I said before, providing and planning activities. So if you're thinking about going to work in a nursery, but you're not sure, planning a safe childcare environment, understanding legislation, risk assessment, and how to ensure a safe environment. Exploring local visitor attractions and contributing to your local community. Okay, let's keep on moving. Okay, here's some pictures of some things that have happened recently. This is some healthy lifestyle bits and pieces. So these are students creating a diet and a meal plan for some elderly people. And they did that as part of the lesson. Okay, so let me tell you a little bit more about level 2. So level 2 is called the Extended Certificate in Health and Social Care. It's run by Pearson and BTEC again. About this course, so it's designed to inspire and enthuse learners. So quite often students who join us at level 2 have done quite well at their GCSEs. They're thinking about a career in health and social care. And this is a 1-year course, and it will give you the opportunity to gain a broad understanding of knowledge and skills. Okay. Sorry, my doorbell just went off and someone's just posted something for me. So for example, you'll learn skills like underpinning care values and an understanding of different life stages that individuals go through. So there's lots and lots and lots to learn within level 2. It will support progression on level 3. So lots of the units that you will learn at level 2 will essentially give you the foundation ready to move on to your level 3 provision. Okay. So in terms of what you'll learn, there is exam units. There is 2 exam units. One is all about human lifespan. So again, that 0 to 100, again, looking at different areas of development and kind of exploring what might happen at each age group. So the difference between a teenager and the difference between somebody that's elderly. So looking at those kind of diseases or anything that may affect that person at that age range. Okay. The other exam unit is all about healthy living. So ensuring that you have a healthy lifestyle, how you can support people to have a healthy lifestyle. And there's also 8 units alongside. Okay, so 8 units that you will do all kind of via coursework. These units might include things like communication skills. I think I've got a list of some of the ones on the next screen, so I'll go on to the next screen now. So human lifespan development exam, which I just told you about. Unit 2 is health and social care values. So that's all to do with about care values and making sure that you keep things confidential. Unit 3 is effective communication. Unit 4, social influences. This is a really interesting unit. This is all about what influences you to behave in certain ways. So for example, does your family influence you? Do your friends influence you? At what age do these different influences and what age are they important? So for example, as a 4-year-old, your work wouldn't necessarily influence you because you wouldn't have a job. However, when you're 18 years old and you're being asked by us to go into placement and do some assignment work, and then your job are also saying, no, you need to pick up some extra shifts. So that's what we look at different influences on behaviour. Unit 7 also is equality and diversity in health and social care. So those are really, really key words that you will hear throughout, is making sure that things are equal for people and everybody can access. Doesn't necessarily mean that everything needs to be the same, but it's looking at diversity and celebrating that diversity within health and social care. Unit 8 is individual rights. So again, it's things like making sure that everything stays confidential, making sure that people keep their dignity. Unit 9 is the exam, healthy living exam, and Unit 10 is human body systems and care of disorders. So anybody who's really keen to get their teeth into something really nice and healthy, as in not as in lifestyle, as in health, thinking about becoming a nurse or becoming a doctor, you'll really enjoy that unit. Unit 12 is creative and therapeutic activities. So that's all about supporting people, possibly if you're thinking about working in a care home. that would be a really, really great unit for you. And Unit 13 is the health and social care sector, which is where you will go out into placement. You will have a work placement that you will do as part of the course, which is really, really important, really integral part of our courses that we run here. And that will build into that unit there. Okay, let's keep going. Level 3, Year 1. I'm just going to have a sip of my tea. Level 3, Year 1 is the foundation. Again, there's 2 exams. One exam is, again, building on the Unit 1 exam from Level 2, is all about development and development through the life stages again. So it's all from 0 to 100. You're looking at different theories of learning. It's a really, really interesting unit there. Unit 2 is working in health and social care. So that's looking at all the different sectors, all the different job roles that you could do, all the different professions. And then you have a variety of other units, so 4 or 5 units. The units at Level 3 are much bigger. We also have a placement, so it's 2-week block placement organised by our work placement coordinator, and then we will also organise you a DBS. Okay, again, there's some examples of units covered in Year 1. Meeting individual care and support needs, principles of safe practice, so that covers a lot of your safeguarding. 10 sociological perspectives and psychological perspectives. So if you enjoyed any kind of sociology or psychology at school, this is really, really, really interesting units for you. Okay. Mindful that it's just gone 1:45 and I need to hurry up a little bit. So entry requirements, as we've already said, 4 GCSEs including English. We might take you as a Level 2 health and social care as a merit, and a satisfactory placement report and reference. So especially if you come from Level 2, we would expect you to have done well on your placement. Okay. Second year, again, there's 2 externally assessed units, one of which is in anatomy and physiology, which is your biology stuff. So thinking about the endocrine system, all the different body systems that work well together. And also there's a unit on research, which is the same on childcare as well, and where you'll be given a piece of research and you'll do lots of secondary research around it. It's a controlled assessment, so it won't necessarily feel like an exam, and you can take notes in with you, which is great. And there's 5 internally assessed units as well, including a placement unit. Okay, so you'll continue your work placement, which will usually be in a different setting to your first year to give you a bit more of a wider range of experience. Okay, some examples of units, as I said, there's Unit 3 and Unit 4, which I was discussing already. You also will do some work on promoting public health. So public health is all the kind of marketing, if you like, that's done to encourage people to eat a little bit more healthily or to stop smoking. Things like Movember or Fit for Life. Those are some examples of promoting public health. So that's a really interesting unit. We also do a unit on caring for individuals with dementia, because we do find that a lot of the students that join us are either working alongside their doing their course in a care home or something similar, or they wish to work in a care home. And also actually the just general demographics of the area. We find that a lot of students will have some form of experience of working with individuals with dementia. Okay, again, satisfactory completion of the Level 3 Foundation Diploma. I put there with good conduct. So if you're being a right pickle on Year 1, and you're not really handing the work in and your attendance is a bit poor, we may want to sit down with you and have a discussion about whether you should be continuing on to Year 2. In terms of your progression options, I've got a couple of slides coming up about progression as well. But in terms of how, once you've completed this Level 3 course, it gives you the UCAS points in order to go on to do a degree. Depending on your grade, obviously. So for example, if you had lots of distinctions, it will give you the equivalent. So distinction star, triple distinction star, essentially, will give you the equivalent of A's at A level, if that makes sense. So there's a parity there. So it won't benefit you particularly doing A levels rather than a BTEC health and social care diploma. So students that we've had have gone on to study nursing, midwifery, criminology or law. And you can also go directly to work in the care sector. So where have our students progressed? So I've given an example here of some students at Chippenham College. So 5 of them out of 12 students, 5 of them accepted based on nursing degrees. Of the other students, most of them went on to degree courses offered by other universities. So Oxford Brookes, some stayed with us at Wiltshire College and University Centre, some went on to Bath Spa to do social work, paramedic, science and education. and all year 2 students have either a job offer or university place offer. So it's a really, really strong course to be doing if you're wanting to progress or go straight into work. We have excellent results. Okay, so progression actually within the college and university centre. So we have social work. Social workers perform a key role in providing the right support at the right time to individuals. Degree will provide you with all the knowledge that you will need to make a real difference to people's lives. So year 1 of the course is very college based, and is taught over a maximum of 3 days in college, which is similar to all of our other courses. Years 2 and 3 is a mix of college based learning and practice placement. So these placements can last up to around 6 months full time. So this is a big time commitment joining us to do the social work. In terms of entry requirements, 3 A levels at grade C or above, or a BTEC extended diploma at grades MMM, which is 96 UCAS tariff points. We also ask that students have experience of paid or voluntary work with vulnerable people. So this will really demonstrate that your commitment, motivation, and understanding. Okay, so it's not just something you can decide, I quite fancy joining social work. You need to have really thought about it before you apply to us. Okay. Our Higher National Certificate and Higher National Diploma, designed for students who are actually working in health and social care settings. So we have a variety of different students join us on this course. Some are mature, some come straight from level 3 and who are working. The level 4 is equivalent to the first year of a degree. The level 5 is equivalent to the second year of a degree. They're recognised internally and externally as being very, very, very high quality RHNs. And if you wanted to, you can progress onto a nursing degree afterwards. You can also progress with a social work degree, and we're in the process of setting up a health and social sciences top up, so you'll be able to get a full degree with us. But this is essentially your year 1 and year 2 of university. Okay. In terms of student life, I'm kind of coming towards the end now, guys. So if you have any questions, please feel free to pop them in the chat pod, and I will answer them for you. Okay. Student life at Wiltshire College. There's a student comment room, cafeteria, HE study areas. Obviously, at the moment, things are a bit different because of COVID, but hopefully we would expect that things will return to normal when you join us in September. We have a student life programme, including tutorial. So you'll be given a tutor who will support you pastorally to help you with all your kind of social side of things. And we also run an overseas trip each year. So, for example, that picture there that I put on the slide is of Portugal. So the students went off to see how health and social care is done in Portugal. So a fab time, and spent some time on the beach, actually. Some of you will have maths and English built into your timetable. There's a dedicated staff team. We are all experienced staff from industry. So we have mental health nurses working with us. We have, my mind's gone blank now, people who manage nurseries. We've got primary school teachers. We've got a really, really wide range of experience. We also have a work placement coordinator, who is our lovely Nikki, who will help organise meaningful placements for you. What's really great is we tend to find that students who come onto our courses make friends for life. So it becomes community. It's great. We'll also give you career advice throughout your course. So as I said before, we've had students who've gone on to do law, changed their mind slightly about what they want to do, which is absolutely fine. On my next slide, I've got some, so this is all part of a unit. This is 2 of our ex-students. And these guys set up essentially a postcards for those with dementia. So it was a really, really lovely. So they kind of set up this whole event, sending postcards to people that are living in care homes. It was great. Lots of that kind of things going on with us at Wiltshire College. We allocated a dedicated personal tutor. You'll attend a group tutorial each week, which is run by your tutor and include group and one-to-one sessions. Cover a wider subjects, including your career, staying safe, and you can have one-to-ones with your tutor as well. Okay. You'll also have the opportunity to join our student union, which is very exciting. You'll be given all of that information as part of your weekly tutorials. And there's also lots of sports that goes on at college. They'll arrange a variety of sessions for you to join in with free of charge, which is great. These can include archery, Zumba, badminton, gym sessions. So the sport you like to try, then let your student union or sport activator know. So yeah, that is me pretty much done. I'm sorry that I have waffled on for 26 minutes. Please let me know if there's any. I'm going to give you a couple of minutes, and I'm going to stop the recording now. But I'll give you a couple of minutes if there's any questions that you want to ask. I think somebody's typing now, which is great. But I'm going to stop the recording and then I will answer your questions.